Hello everyone, welcome to Bangor Uni's Department of Sport and Exercise Science webinar. We will get started in a few minutes. We're just going to give a little bit more time for some people to join. Just to let you know, this meeting is being recorded. Your cameras are automatically off. But if you do put any messages in the chat or on the Q&A, people will be able to see those. So just be aware of that. Just while we're waiting for other people to join, if you do have any questions or queries straight away about how it's going to run today, then do just drop us a message in the chat function. And we'll be with you in a couple of minutes. We're just going to do that. Another couple of minutes for people to join. Right, you happy to make a start, Sophie and Larry?
Yep.
Yeah. Okay. So welcome everyone. This workshop or this webinar is called Breaking Barriers: How Sports Science Supports Female Athletes. Very lucky today to be joined by Dr. Sophie Harrison and Dr. Larry Jones. You can call them Sophie and Larry. And we are going to give you a very brief intro about themselves. They will talk to you about who they are. And then we'll give you a little bit of an intro about what we're going to go through today. And then we're going to use some case studies to really show you how sports science can better support female athletes. So my name's Jamie. I'm one of the lecturers in the Department of Sport and Exercise Sciences at Bangor Uni, and I'm going to be chairing today. Sophie, do you want to just introduce yourself?
Yeah, of course. I'm Sophie Harrison. I'm a lecturer in the Department of Sport and Exercise Sciences at Bangor University, and most of my research focuses around the female athlete, supporting them around menstrual symptoms and menstrual symptom management.
And Larry?
Hi, yes, I am a lecturer in the school and I'm a psychologist. So I work mainly on the mental side of the game, but I have research interests in supporting women in all aspects of their lives, whether that's through, menstrual cycle or postpartum experiences. And I'll touch a little bit on that today.
Okay, so just a little bit of background about why we're talking to you today. So more and more women are taking part in sport. At the Commonwealth Games in 2026, for the first time, I think, more than half, 58% of Welsh athletes were women. And we also know that more and more women are returning to sport after having a baby. Unfortunately, historically, for all the research that's done in sports science by people like Sophie, Larry, and myself, only 6% of it is really focused on female athletes specifically. So there's a huge body of research being completed in sports science, but it's biased towards being completed in men. Female-focused sports science is now, luckily, a growing field, and that's exactly why Sophie and Larry are working in that area. And today, what we're going to do is explore how the menstrual cycle and menstrual symptoms influence female athletes, and how we can better support women returning to sport after childbirth. So this session might be personally of interest to you, but it's also ideal for students considering future study or careers in sports science, sport medicine, physiotherapy, sports psychology, or coaching. So I think what we're going to do, and Sophie will give me some nods, is that I'm going to outline a case, and then Sophie's going to help to take her through the approach that she would use to be able to actually support that case. If during the webinar you have any questions, you're welcome to put them into the Q&A, and there will be an opportunity at the end for you to also have some protected time to ask any further questions to Larry and Sophie. Okay, so you should see at the top of your screen, there's an option to use a Q&A function. It's a button at the top. You can also use the chat function if you want, but if you can put it on the Q&A, it just helps my little brain keep up with all of the chat coming in. Okay, so the first case today is about Bethan. She's a 17-year-old competitive swimmer. She has seen some posts on social media saying that she should sync her training to her menstrual cycle. She is wondering if she should complete more strength training in the second half of her cycle and just focus on stretching at the start of her cycle. So, Sophie, could you take us through what you would advise Bethan to do in terms of syncing her training to the phases of her menstrual cycle? And I gather this is a very common question that athletes pose to you, to their coaches, when they're thinking about their own training.
Yeah, definitely. So I'm just going to use a few slides to kind of answer this. So this is one that we get quite a lot. So my question, first of all, is we see quite a lot of posts around this. I don't know if can you use the reaction function at the moment? If you can use the reaction function, can you put your hand up if you've seen any advice anywhere, or put a reaction in if you've seen any advice anywhere on social media that we should be changing our training around our menstrual cycle phases? So just put a little reaction in if you've seen that. Yeah. So quite almost, over half. Yeah. So loads of us have seen that around social media. So before we start, what do we mean by menstrual cycle phases? So you might have seen a drawing similar to this before, and you might have heard these words bandied around, but this is what a typical normal menstrual cycle might look like. Its length can be anywhere between 21 and 35 days, and we would consider that completely normal. And the period normally lasts anywhere between 2 and 7 days. Again, that's completely normal. So we have these two distinct phases, and they're kind of split down the middle by ovulation. So ovulation is when an egg is produced and released, and that's kind of the key defining point between our two key phases. So ovulation only lasts for around 24 to 48 hours. It's actually a really, really short part of our menstrual cycle. Before that, we have something called the follicular phase. And the follicular phase can kind of be split into two sections. So during this early follicular phase, I'm not sure if you can see my mouse or not, I'll put that on. So during this early follicular phase, we have our two hormones, the big ones for the menstrual cycle are estrogen and progesterone. And both of these are low at this time. And that's generally when we have our period. After our period ends, we then see this rise in estrogen, and that peaks sort of just before ovulation. And that's when you might see a lot of people talking about feeling better, feeling more confident, feeling stronger, and then leading into ovulation. We then move into something called the luteal phase, and that's characterized by this big spike in progesterone, the other hormone that we see throughout the menstrual cycle. And the luteal phase, particularly that late luteal phase, is often associated with premenstrual syndrome in some people, where we might feel very anxious or very tired as well. So what is cycle syncing in terms of training? So these might be some of the sorts of social media posts that you might have seen. I know a lot of you had seen a lot of them about that might talk about training differently at different times of your cycle. So during the menstrual phase, so early follicular, when we have our period, doing more walking and stretching, and then around ovulation, doing more HIIT. In the luteal phase, maybe doing lower intensity exercises. In the follicular phase, doing more weight training and slightly different things going on. But when we look at the scientific research, although this is very popular, it isn't actually well supported by research currently. So it's a little bit of a myth at the moment. So I want to talk to you about a key paper. It was published in 2020. And what they did is they looked at 73 different studies that had explored menstrual cycle phases and exercise performance. And what they found is there was actually only a very, very small reduction in performance during the early follicular phase, so that time when the period occurs. And what they also found is that many of these studies actually didn't do a very good job of assessing when those phases happened. So those phases that I talked about, they can be quite variable between people. We can't say that everyone has ovulation on day 14 or everyone's cycle is going to be 28 days long. It's actually more nuanced than that in terms of determining which phase of people are in. It takes knowing when ovulation is happening and maybe knowing what our hormone levels are at specific times to help us to determine that. So a lot of the work that had looked at this historically hadn't actually seen hadn't done a very good job of categorizing phases. And then when we actually look at that research, we didn't see that many differences between the phases. So what that tends to suggest that there's a bit more work to be done here. And this research does not currently recommend a one-size-fits-all approach. So from my point of view, if an athlete came to me and said, I've seen all this stuff around cycle syncing and changing my training around my cycle, although it's quite popular and it's out there in the media, I actually wouldn't be advising Bethan to change her training around her cycle. We just don't have good enough scientific evidence at the moment to support that that's going to be beneficial for her.
Fantastic. And I think there are not just females on the call today, just watching the webinar. So it is often the case still in sport where you will have male support staff supporting female athletes and female trainers, so people who are training. So I think us understanding this and how to answer these questions is really helpful. Thanks, Sophie. So we're going to go on to the second case, and you're going to give me a nod if that's okay.
Yeah.
Yeah. So the second case is Nadia. She is 24 years old and likes going to CrossFit. She sometimes notices that she feels really tired and anxious and struggles to go to the gym. She is wondering if this could be related to her menstrual cycle. So how can Nadia understand whether these symptoms are related to her menstrual cycle or to some other underlying other issue?
Of course. Okay, perfect. That's really helpful. So I can get this move on. So the first thing I'll be looking at here with Nadia is to understand whether those symptoms are having cyclical patterns with her menstrual cycle. So the main way we can do this is by looking at menstrual symptom tracking. So can we track those symptoms over a number of cycles and see if they are recurring at the same time around her cycle? But before we do that, and before we go on to do any tracking with athletes, there's a number of considerations that we need to think about. So we need to think about ethical considerations, making sure that the athlete is always given a choice, that we're being very careful about what we're doing with that data or where we're sharing that data, and that that's open and honest with that athlete or with that person that we're working with first. Make sure that we're using appropriate tools and methods to track those symptoms, and I'll talk about that a little bit in a minute. And making sure that we provide sufficient education around the symptoms. So we don't just send them off to track and do their own thing with it, that we provide education for those athletes and that we show that ourselves as practitioners that we've had education. That increases a lot of confidence for athletes to be able to have those conversations with practitioners. And make sure that we support individual, positive and objective interpretation of symptoms. So we're not using that data in any sort of negative way. So we're not using it in terms of to inform team selection or anything like that. Make sure we try to stay positive, looking at it from an individual lens, so not trying not to provide blanket recommendations, and make sure we're being objective in that interpretation. Make sure that we provide supportive interventions once we've tracked symptoms. So not just tracking symptoms, finding this out and sending them off on their own, and making sure that we support to resolve whatever's coming up as well, and that we communicate openly and honestly throughout all of these conversations. So here's a few tips for kind of tracking to get us started. So there is not a one size fits all for tracking symptoms. The best tracking tool for the person is going to be the one that they're going to stick to and that they feel most comfortable with. So that might have a range of things. It might look like using a paper-based diary that you make yourself. It might look like just writing in the calendar, or it might look like using one of the many apps that are out there at the moment. And when we start tracking, if someone has not been tracking at all before, the first thing I'd be looking at is just tracking when their periods are. Are they having regular periods within that 21 to 35 day window, so that we can highlight any sort of red flags? Are they having any like significantly really long periods, so longer than 7 days or less than 2 days? And are their symptoms sort of having a really, really detrimental impact on their life? If they are, I'd be referring them on for sort of medical attention before proceeding, just in case there are any underlying conditions going on there as well. Once we're happy with that, we then would be looking at tracking those symptoms across the cycle. So I've put an example of a few symptoms up here that you might think about tracking, but there are over 150 symptoms reported that athletes might track or that might impact them or they might experience around their menstrual cycle. So I would be encouraging that athlete to have a think about the sort of things that they're noticing that are bothering them maybe on a day-to-day basis, and or might be more important for them within their sport or their physical pursuits, and focusing on those with the athlete. Do you want me to carry on, Larry? Do you want to talk about this a bit?
Yeah, thank you, Sophie. So I think Sophie mentioned there, but some of the key things is really thinking about that individualized approach to an athlete. And one of the things that we've suggested in some of the work that we do is when you're tracking that information is then thinking about, well, what strategy do I do then? I know what my symptoms are. Could I take different approaches? And what we suggest is either a management and minimization of symptoms approach or adjustment of training around symptoms. So rather than just thinking about the cycle as a whole, we think about, okay, what are the symptoms I'm experiencing and how then would I manage them in my training or in my competition? So a management and a minimization of symptoms approach might be allowing participation in all modalities, intensities and durations of exercise. So for example, for Nadia, this might look like putting in place interventions to help her sleep and anxiety so that she can still carry on going to the gym across the whole menstrual cycle. So thinking about what she might do to help with those symptoms, where an adjustment of training around those symptoms might mean for Nadia that she looks at changing the type of training she's doing. So it could be that she shortens sessions or she reduces them. She maybe adapts them, maybe thinks about different approaches. And for any of you who know CrossFit, it is all about adapting training sessions. So it's quite a good sport where maybe she could employ that principle of adapting or training around symptoms. Why this is quite important is because we want to encourage people to train and throughout the whole of their cycle. And if we think about athletes, they might not often get to choose when competition arises. So if someone is quite competitive, a management and a minimization of symptoms might be really important, because it might be that their period, for example, and they might have some symptoms around their period, falls on a day when they're competing. And from my own experiences of working as a psychologist, this happens quite a lot with athletes who, you know, they've potentially not tracked their cycle, and then they think, oh, actually, I'm competing tomorrow, and my period's just started, and they've kind of thought, oh, actually, those symptoms now are going to really impact my training. So I think building on what Sophie said around tracking your symptoms is really important to be able to then understand how then it might impact whether it's training or competition. And then what we're really interested, sorry, I'll just carry on a little bit more, Jamie, is actually understanding some of these management strategies that we might suggest. So it might be that, okay, we're talking about Nadia and she wants some management strategies. The research out there is less well established around these interventions, but that is an area that we at Bangor University are trying to develop further. So I'll speak a little bit about the kind of psychological perspective, and then I'll pass back to Sophie. So from an anxiety perspective, and we know that anxiety, low mood, irritability are some of the kind of most reported symptoms and potentially the most impactful symptoms around the menstrual cycle. So from a psychological perspective, what are the kind of some of the management strategies we would be able to use? So in the literature, there is some research around things like cognitive behavioral therapy, so CBT, which you might have heard about. So opportunities to talk about those anxieties within a support system might be really important for individuals. Mindfulness has also some research support to suggest how you might think about, well, actually, I know at that stage of my cycle, I've become really anxious, so I'll go away and do some mindfulness exercises. And I think importantly for individuals, actually tracking your cycle is a form of intervention. So it gives you that autonomy over your own body, because you're understanding your body a little bit better. You're understanding, actually, this is how I feel at these different parts of my cycle. So that is a really good intervention, will help you understand, actually, I know I'm at this stage and I typically feel like this at this stage. And that gives you kind of that autonomy around your bodily symptoms and how you feel, and then how you might manage those as well. And then I'll pass back to Sophie to talk about the sleep aspect.
Yeah, and I think that's a really good point, Larry, about that tracking just being a form of intervention in and of itself. You know, I've worked with athletes who have recurrent knee pain, and they didn't know why they had recurrent knee pain, and we looked at it around the menstrual cycle and noticed it was happening around ovulation every cycle. So where they previously were really panicking every time they had that knee pain that they were getting injured again, just having that knowledge and that information that that was happening because of the menstrual cycle at a really specific time, it allowed them to reduce some of that anxiety around that recurrent pain as well. So yeah, you're right, it is an intervention in and of itself. So when we think about then, she said she was struggling with like sleep as well. And this is quite an interesting one, right? Because although we don't have as much research about necessarily the ways we can manage menstrual symptoms per se, and we need to do a bit more work on that, and we're trying to do that at the moment. One thing we do know quite a lot about is managing sleep. So although it's not necessarily research related to the menstrual cycle, we do know a lot about interventions of how we can maybe introduce better sleep. So simple things like improving sleep hygiene, so not being on your phone too late before bed, not exercising or eating too late before you go to bed, trying to make sure that you're in a cool environment as well, so it's not too hot, which has definitely been difficult recently. And then other things that we can try and introduce. Again, if we've tracked and we know that this is going to be a time that maybe sleep disturbance is going to be an issue, can we look at how we can extend our sleep during this time? Can we try and make sure that we're going to bed earlier, or providing opportunities to have more lie-ins? Or can we provide opportunities to allow napping to happen during those times? You know, we if we know that these things are going to be happening, we can then plan better to manage these things.
Fantastic. And I don't know if everyone else is doing this, but I'm thinking of lots of questions. So feel free to scribble those down, or if you want to, you're welcome to put them into the Q&A now, and we'll try and go through them all at the end as well. So if you're someone who doesn't like writing things down, but you're worried you might forget your question, then do just put it into the Q&A now, and we'll answer those later. Just one thing I want to pick up on there is just, you talked about this idea of minimizing symptoms, and that's already answered one of my questions, which was about the very first social media posts you suggested. They were saying, oh, during this part of your cycle, you might want to stretch and walk and nap. And I was thinking how unrealistic that would be for certain athletes who want to compete or want to continue training throughout that cycle. So seeing that minimization technique there, I think is really helpful to allow them to continue to participate at the level that they want to. And am I right in saying, Sophie, we're going to go on to case 3?
Yeah.
Okay, so case 3 is Moada. She is a 35-year-old competitive triathlete. She's had her first child and is 6 weeks postpartum. So she's probably very tired. She wants to return to training and competition, but is not sure where to start. Okay, so where did you first off direct Moada to get more information? I think Larry's going to go first in that one.
Yeah. So I guess just to start off with, there's some, fantastic examples of athletes now returning to sport. So some of you may have watched Wimbledon yesterday. Serena Williams returning once again after a second child at 44, at the elite level of sport. So there's some fantastic examples that, in the sport that you follow, you might have seen people returning, which is amazing, because traditionally in sport, having a baby seemed like the end of a career for an athlete, for a female athlete, and we're really breaking the barriers there in terms of actually seeing, you know, females successfully returning to sport, and I think that's a fantastic thing. Obviously, they're examples of elite athletes and people who have lots of support around them. But for someone like Mwada, there are some fantastic resources out there now. So specifically, the Active Pregnancy Foundation is a fantastic source of knowledge and information. It's research driven, so it has lots of guidelines in there about how we would return to sport after pregnancy. So pregnancy is a substantial life event where it has lots of physical aspects related to it, and because of that, some great guidelines have been developed to support returning to sport and physical activity. So there are some great guidelines around running now, because typically, if you, for those who experience pregnancy, they would get a 6-week sign off by their GP to say, yeah, you're back, you can go back to sport. But we know actually that's quite a simplistic way to look at it. And lots of different sports have lots of different demands on the body. So understanding that is really important from a sports science perspective, from a coaching perspective, from supporting our partners perspective. And I think that is coming through really nicely within the literature now. So another really great example is the one that you'll see on the screen here about getting pelvic floor ready to return to rugby postpartum. So obviously through pregnancy, your pelvic floor muscles have changed a lot, and we don't necessarily have lots of education around pelvic floor health within growing up or when having babies. So these guidelines are really helpful to think about, okay, different stages of my return and how different types of the rugby experience will impact my pelvic floor. And rugby in particular is an example where we're seeing great stuff. Again, there's a great documentary on Netflix around Abby Ward, who successfully returned to rugby, and from a Welsh perspective, Alicia Joyce, I think 5 months post-pregnancy was back playing. So some really great examples of sports that are leading the way in this. So that's really where we can see sports science having a real impact on supporting these women back into sport. What a lot of this does is focus on the kind of physical side of things. And as a psychologist, I'm quite keen to understand the psychological impacts of returning to sport after pregnancy. So if Sophie moves on to the next slide, I'm really interested in that kind of biopsychosocial perspective. So more of a holistic perspective of understanding. So the guidelines are great because they give you some real physical instructions and information about, okay, physically how I'm going to feel, but quite often the psychological aspect is neglected in some of these guidelines. There are some great examples out there, but not always. So what I'm really interested in is understanding that actually after having a baby, you might go through lots of different feelings and emotions that might impact your readiness to go back into being physically active. So moving away from just thinking about elite people now, thinking about, you know, actually I've just had a baby. So Mwada, for example, you know, 6 weeks postpartum, she wants to get back, but thinking, actually, can I do it? I've got a bit of uncertainty around it. I've got lots of conflicting advice. Should I be doing it? Should I be going back in? I might have some loss of confidence because my body might have changed. There might be reduced opportunities because now I have to factor in childcare, and that the training times I normally engage in might be at, you know, a time which is not convenient for looking after my child. And there's a lot of pressure to bounce back in for these women to, you know, bounce back into physical shape and back to where you were after having a child. But having children is a massive, as I said, a massive life event, something that really significantly impacts our bodies. So why should we be bouncing back? So for me, really, it isn't just a medical issue. It's a kind of a whole biopsychosocial perspective. And this is something that we tried to explore research that we did at Bangor University. So in triathletes, we looked at this. Triathlon is an interesting sport to look at this in because typically athletes will peak in triathlon in their 30s, and that coincides with the average age of having your first child in the UK, which is around 31 at the moment. So it's kind of a nice platform to try and investigate this. So we were really interested in looking at the postpartum experience of these triathlete mothers from a kind of psychological experiences as well. This research has kind of been highlighted quite a lot in at things like the Female Triathlete Hub, which is a great Instagram profile. They have their own magazine. So if there's any of triathletes out there, that's a great one, not just for pregnancy related stuff, but for all female triathletes things. Go and check it out. And then I'll just touch on some of the results there. I'm not going to go into loads of detail, and there's quite a lot on this slide, but it kind of highlights to you some of the key aspects that came out of that research. So athletes were reporting things around a motherhood shift and embracing change. Okay, so actually becoming a mother really shifted my how I felt about myself and how I perceived the world around me being an athlete. So there's quite a lot of a change in the identity. Athletes had a change in motivation, their meaning and their mental mindset, as you imagine. So my why changed. It's not about racing fast anymore. It's about showing up. And quite often people were talking about, well, I've got this hour in the day. I have to do it in that hour of the day because that's when I'm free, and they might have that motivation to get out there and do it. There's quite a lot of information coming out about social pressures, perceptions and support. So there's a pressure to bounce back, as I mentioned, but also people talking about the support that they got that enabled them to be able to get back into a triathlon. Triathlon's a sport which is quite time consuming. So it's, for those of you who don't know, there's 3 elements to a triathlon. There's swimming, biking and running. So if you think about training for all those 3 things, it's quite a labor intensive, time intensive thing. So having the support around you to be able to do that is really important. And then a lot of mothers were talking about actually being an athlete or being physically active is really important for my well-being. And again, this kind of challenges those social norms that we have, that if you have a child, then you should be prioritizing your children. But quite a lot of athletes talk about, actually, I need to prioritize my own time of being physically active to be the best mum that I possibly can be. So they're kind of some of the key elements that came through the research. But if we go on to the next slide, we can just touch on, you know, what we would do to help Marwada, then some kind of key things. So as I mentioned, having supportive partners is really important. So having someone who understands your dedication or your need to go out and participate in physical activity, whether that's triathlon or whatever, is really important. Having flexible goals being set. So this is really important from a kind of postpartum perspective, because actually those goals might change quite a lot. And I think quite often women, when they fall pregnant, they get asked the question, when are you coming back? Rather, we should be asking the question of, what can I do to help you get back? What can I do to support you get back? And having flexible goals might be part of that. So it's not like, I am wedded to doing this event in 10 weeks' time. Having some flexibility around it. Organisation and planning, as you can imagine, is really important and came out really in our research. So planning everything is really important. Reframing the exercise, so not feeling that mum guilt about it, actually thinking, actually, I need to do this to become a happier mum, to be a better mum. And community and social support was also really important in our research. So on the next slide, we'll get some more of those kind of key take-home things for specific types of people working within athletes. So for healthcare professionals, it might be about asking about what the sporting goals are, referring when appropriate. For coaches, it might be, as I said, replacing when are you racing again with what does success look like for you right now? So how can I help you get that success? For athletes, I think it's about listening to symptoms. So, you know, understanding your body, and a little bit in relation to kind of, I guess, Sophie's aspects of tracking your symptoms, thinking about, okay, what symptoms are going on for me right now? How can I manage those symptoms? What can I do? Progressing at my own pace and redefining success if you need to, and also seeking support early. So there aren't there are some great support systems, but from a maternity health perspective, there could be some much better support systems. And in our research, quite often athletes would talk about that they would go on to Instagram, social media to get the support or to get advice. And I think a caveat really needs to be given into that, as kind of we spoke about earlier, that social media doesn't always have the best advice out there. Sometimes the advice on social media needs to be questions. So trying to find places like the Active Pregnancy Foundation where we know it's good quality advice is really important. And then for organisations, for having really clear policies and pathways for people to return to sport is really important, and being very open about, you know, the culture about having children and supporting women getting back. I think that's why organisations work really well, is where there's a kind of culture shift to support women who have children and then getting back into their athlete career. So there's quite a lot in there, but there's also some take-home aspects in terms of, like, if I would be working with athletes in the future. So if there are any sports scientists there, any coaches in the audience, some of the things that you might consider, okay, actually, if I have athletes like this, what would I do around that? And I think these are things that we didn't necessarily have a few years ago, but is coming out really well in the research, that we know how to support these women and effectively getting them back into, whether that's competition or whether that's just being more physically active, I think is really important.
Okay, so thank you very much. So just before I go into some conclusions and overarching principles that I think we've talked to us today, and we go into a Q&A session, is there anything else that Sophie or Larry you want to add just on to the end of your slides and talk there?
No, I think that's it. I might, if it's okay, I'll pop some links in the chat as well for people. So to some of those resources that we talked about, Larry and I both have papers related to those things that we can share, and that might be useful for people to take away.
Yeah, it might be helpful for those of you who are going to be doing assessments for your A-levels, BTECs, GCSEs, things like that in the future, or if you are already working and supporting athletes, then maybe there's something you could take away and use there. So just while I summarize then, please do put some questions into the chat or the Q&A. I can see someone's just made a comment already, so thank you for doing that. You'll see on screen we've just got some QR codes that you can use just to go out to our social media channels, Studying in Welsh, and also our general sports science landing page. So today, I think some take-home messages or overarching principles. So I think that what came across is that despite social media suggesting that syncing training to menstrual cycle phases could potentially be helpful, then the current research does not necessarily support that as an approach. And you may want to think about more individualizing the advice that you give to your female athletes. Secondly, that tracking menstrual symptoms is an intervention in itself, and that might help athletes to really provide some individual insight, but also act as an intervention for them to allow athletes to better prepare and manage their symptoms for sport and exercise. And for our postpartum athletes, having supportive partners and thinking about being really flexible with goal setting, taking into account the individual needs of that female athlete, organisation and planning, reframing exercise, and providing community and social support would really help with an athlete's individual return to sport. So what we've got now is an opportunity for you to ask some questions. So you can put your hand up if you want to and ask personally, verbally, or you can put your questions into the chat and Q&A. So there is a question from Ritu straight away, which is, I was wondering how cycle syncing and training would look like for women who might have menstrual dysfunctions. So would love to know more and discuss similar topics, as my area of work is menstrual dysfunctions in sport. Okay, so I'll let Sophie and Larry just have a go at tackling that question, while other people might add some questions of their own into the chat or Q&A.
Yeah, so it's a really interesting one, and I think being open and honest up front, I think it's an area that we just don't have enough research in sports science about at the moment. Those women with menstrual dysfunction, so if we're thinking like PMOS, it's now called, sorry, PMOS, or endometriosis, they are unique conditions where, to be honest, we don't have a lot of research in that area, and their cycles may not look like those traditional cycles. They may not be regular. They may not see these repeating patterns of symptoms. So it's going to be looking into specific interventions that might be able to help these athletes specifically, and that's going to look quite different to our athletes without those menstrual dysfunctions. So I don't think we have all the answers to that yet, and it's definitely an area where we need more research, but we certainly can't be looking at sort of cycle syncing with those athletes. We can't necessarily be looking at patterns of symptoms even with those athletes, because a lot of the time they don't have those regular cycles like we would expect. So that's not the most helpful answer at the moment, but it almost, I wouldn't be looking at doing that. Again, taking that individualized approach. What symptoms are they experiencing? Can we look in the literature to find interventions that might help with those symptoms that they are experiencing that are influencing them within their own physical activity and sport? Larry, anything you'd add?
I think, reiterating what Sophie said, there's kind of a lack of research, but also there's a lack of reporting of a lot of those menstrual dysfunctions, which makes it even more challenging, I guess, from a research perspective, because quite often people might think that they've got some of those, aspects of like endometriosis, for example, but they haven't got a diagnosis of it. And it is very difficult to get a diagnosis of endometriosis, for example. So it might be, from a research perspective, quite difficult to kind of manage that with any participant pool that we've got. But from a kind of applied perspective, when working within individuals, I think taking some of the principles around things like having that awareness and tracking of your own bodily symptoms is really important, to be able to give like an individualized program for those athletes, or an individualized management strategy for those athletes. So I think it kind of, there's two aspects. There's a research aspect, which is really challenging, but there's the applied aspect where we can take some of the stuff that we've mentioned already and support those athletes the best we can.
And Rebecca has a nice question here about the link between the menstrual cycle and injury risk. And I'd also add on to the end of that, the link between being postpartum and injury risk.
Cool. So I can take a little bit on the first part around the menstrual cycle. So yeah, there's a lot of media attention around this at the moment, particularly around sort of ACL injury in female athletes and that high proportion. And there's some research sort of theorizing why this might be happening, but I don't think we have a real set answer to this. So there's a lot of theories about it being around ovulation and maybe joint laxity changing, but no one's confirmed that yet with research. So I think the jury's still a little bit out with this one, and there are a lot of factors that probably contribute to that. So it might be that there are physiological changes happening, but it might also be that the way that there have been changes in sports. So if you think about in football, the boom in women's sport, the professionalization of women's football, they maybe haven't had the pathways leading through that their comparative male athletes would have had that same S&C from a young age, that same support from a young age. So are they just more at risk now because that load has increased so significantly so suddenly for female athletes? And I don't think we have all the answers to that yet. So yeah, I think it's going to be really interesting to see what comes out in this area, to see if there are any physiological differences going on, and whether we're getting more of these injuries around ovulation because of changes in joint laxity, or whether it's other factors that are going on. So it'd be interesting to see if that pattern continues as female sport begins to grow and become more established, and more of those support pathways hopefully come into place for female athletes as well. Do we still see this heightened risk of injury in female athletes?
And I suppose there might be other mechanisms as well, like decreasing muscle function, reaction time, proprioception during different phases of the cycle that may also lead to increased injury risk.
Yeah, exactly. And things like interoception, so how we notice things in our body. Larry and I are going to do some research on that. And then like psychological changes as well. We know that, so I know that there's research looking at when we get ill and we get anxious about that, we're more likely to get injured. So when we have this increased anxiety about illness, we're more likely to get injured. So again, there might be things like that going on where our athletes are feeling a bit more anxious or feeling low confidence around their cycle, and that might be increasing injury risk. So yeah, there's a lot of things that might go into it.
And Larry, is that a similar sort of pattern, do you think, for postpartum?
Yeah, I think it's a similar story of there's a lack of research there. It hasn't been done yet. But traditionally, it's kind of focused on, I guess, aspects, not always, I guess you wouldn't label them as injury, but aspects that from a physical perspective would change because you've had a baby. So, for example, your pelvic floor, like I've mentioned, or diastasis recti, where your abdominal wall is separates, and how we might rehabilitate people, individuals after having children. So quite a lot of the focus has been on that, rather than, you know, the consequences of being injured, being pregnant, and then on injury hasn't really been explored. But I guess you could hypothesize a little bit like Sophie has done there, that, you know, the tiredness of, you know, being postpartum and then trying to get back into sport is that have an impact from a psychological perspective around yeah. But I think from a hormonal perspective, there's also kind of quite a, like, you know, fluctuations of different hormones postpartum, and then quite often then thinking about maybe going into the kind of perimenopausal state as well. So there's a need really, and I guess it's a great call to arms, isn't it, for any budding sports scientists out there to think about, actually, that'd be a great research project. You know, I'm going to go away and look into that and think about how I can work in that area to better support athletes, whether it's from a research perspective or whether you think about, you know, I want to be a physiotherapist and I want to work with female athletes, for example, how I might then support them either from a menstrual cycle perspective or a postpartum perspective. It is, yeah, it's an interesting area to be thinking about going into. You know, it's exciting, and I think there's loads of opportunities as well to in this field.
So come and study sports science to prepare yourself for that exciting opportunity. And are there any other questions that people would like to ask? I'm going to ask one, maybe just while people think about that. So, do you ever get athletes asking you about using a contraceptive pill to help manage their symptoms during their training and competitive cycles?
Yeah, yes, is the answer. I think you know, for lots of different reasons, and I kind of touch on my own experiences, but quite often using it so that they can have control over their cycle and know when their you know, when their bleed might be, for example, might be in a, you know, a way some people might use contraception, because then they can think about, and not advocating this, but some people might use contraceptive pills back to back to avoid having a bleed, for example, if that's the type of contraceptive pill that you're on. That is definitely a strategy that athletes have used in the past, but I guess Sophie might have more expertise to talk about it from a kind of physiological perspective.
Yeah, so it's definitely something we see, and actually the current NICE guidelines, so our National Institute of Care Excellence guidelines do recommend hormonal contraceptives as one of the first lines for managing menstrual symptoms. So it's definitely out there. There is some skepticism now about whether, or some interest about whether hormonal contraceptives can influence our ability to exercise and our adaptation to exercise. Again, there's not really strong evidence of that showing any differences at the moment. But there are sort of athlete-specific considerations, and many of our management strategies that we talk about come from recommendations within the general population, one of which being hormonal contraceptives. So some of the work we're trying to do now is trying to explore specifically for female athletes, are these management strategies beneficial for them? Are they the most useful ones? Or you know, are we affecting their ability to train and adapt to training? So specifically thinking about like ibuprofen or non-steroidal anti-inflammatories as management. There is some suggestion that this might not be beneficial for athletes because it might increase injury risk at times, or it might reduce their ability to adapt. So I think there is a call now to be looking a bit more at how we're managing these symptoms, specifically for people who are being physically active or trying to perform. But yeah, hormonal contraceptives, there's definitely a time and a place for them. If we have an athlete who is just not able to perform and exercise and their symptoms are better managed through hormonal contraceptives, then that's great.
Okay, I think we're going to bring the meeting to an end. There is a query from Ritu, so and Charlotte's just typing as well, so we'll see what they are. But Ritu just mentioned then about how they may be able to grow their area of research in this particular topic. And my suggestion would be that to start off with, that you just get in touch with us. and think about studying with us. Without giving you a hard sell, but if you drop an email to sport@bangor.ac.uk or have a look on our website for our degrees, then depending on where you are in your academic career and your professional career, then we have options from an undergraduate degree, foundation degree, right through to postgraduate study, which can be done in a distance learning format. So if you've got a particular interest in this continuing research in psychology, we do have a performance psychology master's degree, and people like Aleri actually supervise and collaborate with people like yourself who may be working or interested in this area and might want to do some research and some further training in that. And you can do that in a modular format rather than having to commit to doing a whole master's degree. So do have a look at that as an option. We've got and then if there's not sufficient information on the website to help answer that question for you, then do drop us an email to sport@bangor.ac.uk and it'll get passed down to us and we'll answer it for you. And there's one more question from Charlotte, if that's okay. So is there much information in sports psychology on supporting pregnant athletes?
Yeah, there's quite a lot of emerging research around the kind of psychological aspects of it, and and it kind of focuses in kind of key areas around things like the identity shift and some of the things that I discussed earlier. But there is some work emerging, and actually there's someone wrote a book, and I'll put the link into the chat. So she's written a book called Empowered Birth: Lessons from Sports Psychology for Your Maternity Journey, which is quite interesting because although it's, potentially if you are pregnant or thinking about pregnant, how you might use sports psychology principles, it's quite interesting then how you might think about, well, if I'm a coach or someone working with an athlete, how I might use those sports psychology principles. So that's quite an interesting kind of resource. On the Active Pregnancy Foundation, there is some kind of bits around psychology as well. So there is kind of an emerging area of research, and if I'm more than happy to share more of that with you, Charlotte, if you want to. But yeah, I think we could potentially do much better in terms of, from a sports psychology perspective, like what are the strategies that we might use and how we support and how we approach those conversations with athletes as well, because sometimes pregnancy or menstrual cycle stuff can be a bit of a taboo subject. If you think about if you've got a male coach, for example, and there is some literature to suggest that maybe those conversations aren't so easily had because typically some of these things have been a bit of a taboo subject or not normalized within sports. So yeah, there's lots of work that could be done in that area as well. So I'll share that link to the resource for you.
And Charlotte, you may be able to do some of your own work on this by looking at some of those cases, those athletes who we know have come back after pregnancy or have exercised during pregnancy. Paula Radcliffe is one athlete who I can think of who was pregnant during the real peak of her career, and she was running competitively until the third trimester, and actually posted some of her best times and most impressive physiological assessments during that period. So it would be interesting maybe just to see if there's anything you can find in reports of those athletes who have competed while pregnant, and see if you can gain anything yourself from perhaps their psychological approach during that, or how they were supported during that period. Okay, so Aleri's just putting a couple of links into the chat for you to have a look at now. If I'll give you one more opportunity to ask any further questions that you may have. So if you're just going to put up our QR codes again, if you'd just like to get a bit more info about studying or following our social media, where we post a lot of the lay sort of summaries of our own research, if you'd like to follow that. And thank you all very much for coming today, and thank you to Sophie and Aleri for talking to us. I'm sure some of you at least might be interested in going off and seeing how the men are doing and seeing whether they can bring it home like the women did, or whether they're going to have to wait till hand it over to the Lionesses again to do the job for us. Yeah, so thank you so much for coming to our webinar today, and please do get in touch with us, sport@bangor.ac.uk, if you've got any further queries.
Diolch.
Thanks everyone.
Thank you. I'm just going to end the event, which might kick some of you out, but you should be able to also just use the chat function if you need to